Thank you, Sister Simpson. Good afternoon, evening to everyone. Also, pastors, I don't see any, and I did see Bishop Evan Grant earlier. Little introduction. So, again, my name is Sister Nikki Fuller. I am a family nurse practitioner, board certified, and a certified autism specialist. Today, I will be talking about, like Sister Simpson said, some ENT issues. But before I do that, a little background as far as my professional background. I do have mostly emergency and urgent care professional experience, and then there is the ENT aspect. Okay, so before we can talk about ENT issues or the medical term otolaryngology, what does ENT entail? Those are all your ears, nose, throat, including your head and neck surgery. Some examples of ENT issues are your hearing loss, your vestibular or balance issues, your ear noises, or in the professional world we say tinnitus, nerve pain, your facial paralysis, and a big one in ENTs, your inner and outer ear disorders. When we go down to the nose disorders, we talk about your allergies, sinusitis, smell disorders, obstructive disorders, which include your polyps or your deviated nasal septum. Down to the throat, issues with the voice box, also your esophagus, voice and swallowing disorders, or your benign or malignant cancers of the head and neck. Uh, Time does not allow for me to talk about ENT in its entirely or completely, so I will just touch on 5 of the most common ENT issues that we see in the clinical setting. The first one being sinusitis or sinus infection. Before we can understand what sinusitis is, we must first understand what the sinus is. The sinus is air-filled cavities that's in the skull. They're lined by mucus-secreting cells, epithelium. We have 4 pairs of sinus cavities on each side of the head. They are your frontal sinus, which is behind the forehead, your ethmoid sinus, which is between the eyes. So a lot of times patients with sinusitis would say that they have pain between their eyes. There is your sphenoid sinus, which is a little bit deeper behind the nose. And then you have your maxillary sinus, which is behind the cheekbone. Tiny opening in the bone called ostium, or I will be repeating these words, or ostia. They allow air in the sinus cavity and allow mucus out the sinus cavity. So the passage of mucus, again, we said that we have at the epithelium that aligns the sinus cavity that secretes mucus. So you have mucus that is secreted by the cavities. They pass through